Well, welcome back. Well, 2 months ago, the First Lady visited Jackson, part of a White House effort to try to boost vaccination numbers across the South. Well, today, the White House Vaccination Coordinator came to our area to see how that effort is going. So joining us now to discuss the challenges that our state faces. It must be Monday. No, it's Tuesday. That's even worse. Our state faces is White House Vaccination Coordinator Dr. Bashar Shokair. What brings you to Jackson?
Well, thank you for having me, Walt. Well, I'm really excited being here. I got a chance to spend time with doctors, family physicians, pediatricians, with the hospital associations, with community health leaders, with the state health department, to try to see what else can we do and how we can support each other to get more and more people in Mississippi vaccinated.
Yeah. Dr. Shokair, CDC says we're 49th in the country, excuse me, for complete vaccinations per capita. Your perspective on this, what do you think is causing this vaccine hesitancy among certain states and certain communities?
Well, let me just start by saying that as a country, we have done a really great job in getting so many people vaccinated. We have more than 200 million people in this country with at least one shot. We have more than 170 million people fully vaccinated. But the fact remains we still have tens of millions of people in this country, including in Mississippi, who are still unvaccinated. And look, some people still have questions about the vaccines, and those are legitimate questions, and we want to make sure that we're getting people answers, we're giving people facts so that they can make their informed decision. And I have no doubt when people will get those facts and those answers, they'll be more inclined to getting vaccinated.
So this is what the White House is doing now, is trying to get this information out, the proper information and the correct information about the vaccines. Anything else you're doing to try to get people to come around and see the wisdom of getting vaccinated against this COVID virus?
Well, we have to continue to put the information out for the American public so that they can get their facts and they can make their decision accordingly. We're also working with doctors across the country, and just today I spent time with family physicians, with pediatricians here in Mississippi who are rolling up their sleeves and every single day having those one-on-one conversations with their patients who still have questions about the vaccine. That one-on-one engagement with your doctor is so important, and we'd want to make sure that people are having these conversations. And look, people also trust people they know, so we'd want to continue to engage faith leaders, community leaders. We all have a role to play to get more and more people vaccinated.
Dr. Bashar, I think, when we got the Delta variant, that's what changed everything really for us, because the push was on everybody needs to get vaccinated now. So our governor, now he just spoke today, and again, would not consider any mandates of any kind, not masking, not vaccination, and all. And yet he's very concerned, and has been from the very beginning, about keeping our hospitals open. We have 2 field hospitals open now. We have nurses and other health professionals coming in from other parts of the country to help us. We are clearly overwhelmed, and it's just continuing. We continue to have more deaths yesterday than we've had during the whole thing. What is the Biden administration's take on mandates?
Well, look, we believe that we have to lead by example. So as a federal government, we have mandated vaccinations for the healthcare workforce and veteran affairs. We now the COVID-19 vaccine will be added to the list of required vaccines for the active duty military. We're making sure that our own employees, they're attesting to vaccination status, and if you're not vaccinated, you'll get tested once or twice a week. And we do believe vaccine requirements have a role to play, and we know that employers, whether it's government employers or private sector employers, universities, colleges, all have a role to play, and we have to do everything we can to get more and more people vaccinated and protected.
So it's really important to get the employers to say, hey, if you're going to work here, we got to have you vaccinated.
Oh, and we're seeing that movement happening across the country. I mean, you look at the healthcare organizations across the country.
They're doing it.
More than 250 health systems across the country with more than 2,300 hospitals are already requiring vaccines for their employees. It is one tool that we have in our toolbox. We know, we heard that from surveys, that for some people, if their employers would require it, they'll get vaccinated.
They'll do it. All
Great. Dr. Shukar, thank you so much for being here.
Pleasure.
Just as an aside, since you're going to the White House, me and Mel were talking about it a while ago. Cash incentives. That's what we want.
Hey, look, incentives work for some people, and if that's what would it take to get people vaccinated, hey, let's just get it done.
Lotteries and
lots of tools in our toolbox here. We know to use them all.
All right. Thank you so much.
Thank you so much for having me.
Hey, we're coming right back. Stay with us.